What's really good about Adam is it's accessible, it's web-based, staff can use it easily, it's very intuitive, and that's a real benefit for patients because we're making sure that they get the outcome of their assessments quickly. Previously we were 5 CCGs. We became 1 CCG in 2018. During that period of transition, what we had to do was find a method of communicating between all of the different areas, and to do that I built a database. Unfortunately, it became obvious that our database wasn't going to make it anymore. So we went through a small procurement exercise and Adam actually met all our requirements. You don't want patients waiting because they're making life-changing decisions on the outcome of this assessment. Having that graphical interface just allows me to have a quick look, make sure we know where we're at with the team, and then we can move on to really dedicating that time to patients.
Adam is critical to our service. This is the system that we use for every part of our working day, from the clinicians to our head of service to our administration staff. It is important that we are able to access this system on a daily basis to do our jobs effectively.
It's easy to input the patient information, it's available for the nurse to see. It's a lot easier to assess the patient's needs. We do get a lot of conversations where the next of kin are stressed, and being able to speed up the assessment, to organise the assessment quickly is very important.
It's very important to get, information right and getting the best possible care for each individual. It's that job satisfaction that I've done something and I'm making a difference to someone.
Our main KPI as a service is we have to complete our assessment within 28 days. That's a main KPI that we're able to monitor effectively throughout the Adam system because it's readily available at a click of a button. We can review that information and say we're either meeting this target or we need to do something about it. It helps us develop action plans on how we can move forward as a service and improve.
The system allows us to speed up the brokerage side from the systems that we used previously, is that it's all in one place, it's all on one system, that we can put that requirement on. The suppliers are notified via the system immediately by notifications that they can then go in and supply that information and offer on the packages of care that we are brokering.
Prior to moving to the Adam system, we were averaging about, I would say, over 50,000 invoices a year. We've now reduced to the 1 invoice per week, and it just makes it a lot easier. We code that invoice and we approve the invoice and payments made to the providers. I think what I really like about the system is the security within the actual system. That's really worked well for our clinicians because they're out in public doing assessments, and it's quite sensitive data, so they're always doing backups, there's always maintenance going on, so there's always that assurance that it's well supported and it's secure.
Do you know, it's been one of the best changes that we could have made. I think that it's allowed the service to develop in a way that it may not have done had we stayed. Change is good. I don't think that we could go back to how we were working because we've noticed such efficiencies.